Hello folks, lovely to meet you. My name is Jo Stepanska. My pronouns are she and her, and I am the Digital Health Lead. I wanted to give you a quick update on what I've been learning about digital health and digital health improvements. To frame this, I guess my role here at IPC is really about how we take advantage of digital things for our teams, so that we can grow the organization and boost that positive reputation. Tying it back to, I guess, our strategic plan, it really is about how can we use digital things to improve and enhance the client experience. How can that help us provide holistic care and better chances of collaboration? And how can we use it to manage the business? So really about efficiency and effectiveness. Can it help us do what we do well even better? So over the last couple of weeks or a month and a bit, I've been really visiting all the different sites and talking to a variety of different team members and individuals across IPC Health about what digital means to them. What we've been also doing is sorting a variety of technologies into ones that we are already using and ones that we use well, ones that we need a bit more help with, and ones that we see a lot of potential in but don't necessarily have all the information on how to deploy it or use it yet. In the meantime, I've found that these videos are effective, so over 90 people have watched the first episode, so hopefully people can watch this one as well. And I'm currently in the process of creating a digital roadmap, which hopefully helps guide our conversation about what do we want to use digital tools to help us do. What that looks like in reality is a lot of moving around. I was really lucky as well to get a tour of Wyndham, which is not a place I've spent a lot of time with. I do know Brimbank pretty well, and so still hoping to learn a bit more about Wyndham and Melton. I've done a bit of a deep dive into the history of our websites and technologies and plans, and I've been doing a lot of hanging around in sites and seeing how things tend to work. I've also done a few of these activities with managers and leaders about my observations of what's working well and what's not working well, and things we could improve. One of the big things that is really exciting is that people are really interested in innovating and doing things differently. The trick here is not everyone's working together, so if somebody figures out a great idea, not all of us know about it. Another thing we've identified collectively in a few different ways is that there are some gaps in training and support for staff to use digital tools really well in their day-to-day roles. Some stories of innovation in the past and currently today. So I guess what I have seen and learnt about while out and about is that there are so many examples of people who are already doing the work of digital innovation, and this span things like using telehealth tools like Head to Health, building up new tools around Care Monitor, which is a new piece of software we want to trial for diabetes self-management. We've had examples of people using virtual reality in the Power of a Pain clinics. And recently we've had some big wins in the Brimbank local to get community involved in some of our activities using video recruitment, social media, and QR codes for people to register. One thing that is a bit of an issue, I guess, when we are so far ahead of the curve is that a lot of the pieces of software that we want to use aren't as tailored to our diverse communities as we would like. So I've also heard about examples of tools not being translatable or as usable for people in other languages. I've learnt about transcription software not being able or interested in listening to children and young people as much. I've learnt about, in some ways, not all of our digital tools or digital engagement being suitable for online, or we need a bit more time to figure out how that might work. But there are also really great adaptations in how people are being creative in using new technology. And so one great example of that has been looking at rapid manufacture of dental things. So framing a few of the big ticket examples that we talked about, at the moment there are so many things out there, but when we kind of map them into this sort of a curve, which is ways to grow, we can see that a lot of the digital innovations at the moment are incremental. So they're helping us to do what we do, but a little bit better. There are a few that are more evolutionary, so really help us expand our thinking and our growth. Could be a growth opportunity. But there are still not too many out there that entirely transform us. And that makes a lot of sense because investing in that rapid transformation takes a lot of work and courage to do. So to summarize some of the key things that I've observed and learnt so far, we definitely have the software for that, but we don't necessarily have it working 100% how we want it to, which means that in many ways we often end up using more software or different workarounds to make it work harder for us. Why that matters is because if we really want to have that coordinated client-centered care, then we need to start seeing these bits work together. Just like a team member, we need these to work and communicate with each other so that we can make wonderful decisions for the communities we care for. At the moment, definitely there are a few bugbears that people have had for many years. And sometimes people have given up on surfacing what isn't working anymore. Innovation and digital at IPC tends to focus on, at the moment, what can be done really quickly. And so that often means that those underlying surfaces that kind of get in our way don't really get to be addressed. So some of the wonderful work that we do fades into the background because it can't be sustained with the systems that we have underneath. So there's been many loops, I guess, or generations of community health workers that have grappled with systems like TrackCare, Iris, ICRIS, and Titanium. And so in some ways we need to have an opinion on what we want to do with that and how much we can advocate for change, so that we have those solid foundations for what we want to come. So getting out of that looping cycle. We've also learnt about innovation challenges. So they've been really wonderful in supporting some staff to do amazing things. The challenge here is not everyone has been able to participate, and sometimes folks with great ideas don't necessarily have the time or access to take part. So what's good is that this innovation approach is working. There are changes happening, but again, how can we be more inclusive and accessible to all sorts of staff across IPC Health? Super open to suggestions about that, and especially if there are ways to do this for the digital space, it's really interesting to think about. With many systems with really tight scope, we are often reliant on the needs of these core pieces of software like our CRMs or EMRs, electronic medical records, or customer relation management tools. TrackCare, Titanium, Best Practice, Hot Docs, even ICRIS really, and Iris are some examples. So the tension with all of these are that these pieces of software contain all the information we have about our relationship with our community members and our clients or consumers. And if that piece of software isn't holding that information well or easy to find, it means it's really difficult for us to collaborate around that care. So this is really important. We need to figure out small things that we can do to see, can these softwares adapt with us? It's really important for us to think about how we might be able to stitch some of the information in these softwares together. Something that I've been hearing as I go around the grounds is there a smarter way for me to do this? Chances are people have been figuring it out on the ground for quite some time, both our communities and our staff, on how they can use digital tools better. It would be wonderful for all of us to feel a little bit more confident and capable when it comes to using digital things. And it's definitely important in terms of efficiency, but also providing wonderful care. Which brings me to the point that we're currently in a stage of digital snapback. Essentially, a lot of us stretched really fast, really quickly in order to deliver services online or use digital tools to fulfill our work. And at the moment, without that additional kind of structure or consistency or training around how to do it well, we're at a point where we could just go back to where we were before. So I think it's really important for us to think about what are the things we've learned over the last couple of years that are helping us, and how can we embed that in our day-to-day practice. So on the final thing, it's more of a comment than a discovery really, is really that digital change needs all of us to work together. So it's not just the technology, it's also the teams, the partnerships, the workflows, all need to kind of work together in order to create that transformation. And so at the moment, that's why I'm recording this video and sharing information. Is really what we want to do, is really share back the different things we're learning as we're learning. Again, if you have any questions or would like to reach out on any comments, please do get in touch. Thank you.